Hello, this is Doug Keating with Structural Environments, and welcome back. Today, we're in the studio of Body-Wise Physical Therapy and Pilates Rehab. And with me, I've got Rupal Goradia. Rupal, thank you so much.
Well, thank you so much for coming out. We're happy to have you here.
Rupal, I hear about Pilates, and I've personally been through physical therapy before. And what I wanted to know is, when we're talking about Pilates and physical therapy, I wanted to know how they work together and what is Pilates?
Sure. So Pilates essentially is more of a modality that we tend to use for physical therapy. So from the physical therapy aspect, we're really looking at the structure of the bones and the recruitment of the muscles and the harmony of the tissues. So how well is all of this playing into each other, and essentially how are these things affecting the dysfunction? So how are they affecting this person's life when they walk, when they sit, when they work, or when they just do household things, you know, picking up their children and that sort of thing. So essentially dissecting their daily movements and trying to bring them back to where their body was naturally meant to be. So how can their muscles achieve more of a balance when they're doing the things that they need to do?
Certainly a science.
Right. So, and kind of how that plays into Pilates is essentially we use Pilates to teach. So the great thing about Pilates is it's extremely facilitative. We have all the equipment here that you're seeing is spring loaded. So if you go ahead and grab a hold of that, you can feel that not only when you pull it are you feeling the effect of it.
I can feel it through my shoulder, my joints.
Yeah.
It's different than just throwing a weight around.
Right, exactly.
You know?
But also when you release it, you have to control it rather than sort of letting it do that, right? So it gives you not only the feedback of the noise, but also the feedback of the feel. So now you understand how hard your muscles are contracting, or essentially whether they're working too hard or whether they're working in a more balanced way. So basically, when we think about Pilates and how it plays into physical therapy, is we're using the Pilates to teach somebody how to use their whole body rather than just isolate one muscle versus another muscle. And that's really the way our body is meant to work in real life situations. So it's a great tool to use both of them together.
As I'm going through life, I run across so many people that have different types of injuries, back injuries. Some of my people on the construction side will twist their knee. Even some of my people that I run with have shin splints and knee injuries. So what I wanted to know is, who would be a good candidate for Pilates and physical therapy?
Well, Doug, that's a great question. Pilates and physical therapy is very applicable across a very wide span of clientele, actually. So a lot of the people who you sort of deal with on a daily basis, you know, the people who maybe have a little bit of nagging back pain from maybe gardening for too long, for example, or possibly, you know, they did some home project where they were bending over a little bit too much and maybe their body mechanics were off, and now it's kind of playing into other parts of their life. Maybe sitting in a desk is causing them pain, which maybe hadn't done before, that sort of thing. It's a great way to kind of bring them back to the basics and kind of teach them not only what can we fix your pain today, but how can we get you to a point where you're learning enough where 6 months down the line, if you kind of run into this problem again, you can kind of troubleshoot and bring yourself back to where you need to be, to a more balanced place. A more broader span on the other side of the spectrum would be, you know, athletes who kind of maybe looking to step up their game and kind of bring them to their next level and improve their performance levels. Athletes, dancers, even back down to your weekend warrior who kind of goes out and plays football or rugby and tears himself up over the weekends and then does their 9 to 5 on a daily basis. So.
Well, Rupal, I have to say that I've had a lot of problems with my back, and I've actually injured myself. Strangely enough, even though I'm in construction, I injured myself carrying laundry up to my house. So, but I do deal with a lot of people every day that are lifting and moving heavy equipment. And I actually have people in my family that have hurt their back and have several back surgeries.
Right.
So how do you tackle the back and back pain, which I know is so central to everything you do in life?
Right. So coming back to kind of the foundational aspect of the work that we do here is that, you know, we're really trying to get the core as strong as we possibly can. So all the movement sort of starts in the middle of your body. So how can we get that functioning for you first
Right.
before any of the other muscles are recruited. That way you're creating a solid platform for movement. And your
Right.
situation is very common. You see that people oftentimes hurt themselves doing very normal sort of things.
How embarrassing too. You're like, oh, I don't want to say anything about that.
Right, but really, in reality, it's just kind of the straw
Right.
that broke the camel's back. So it's kind of been, your problem maybe had been leading up to where it kind of brought you, but unfortunately was something that you would have never thought would have caused that sort of excruciating
Right.
pain, I imagine. So, when it comes to treating back pain, the main thing is how can we get you to a point where you're understanding how to use your core. So one thing that I teach to every population, regardless of what sort of pain they're experiencing, is how to get more air and more breath into the lower parts of your body, because as we stress out, we tend to use the upper half of our body and our chest and our neck muscles a lot.
Right.
So to breathe, rather than sort of letting the air kind of fall, deeper into your thoracic cavity, so your trunk area. So that's one of the major aspects, just teaching people to deep breathe. So breathe with your belly, raising your belly up, and then allowing your belly to drop down with your inhales and exhales. Also, your ribs need to come up, and they need to also come out so that they can help your lungs essentially fill up and reduce the air or expire the air out of your mouth when you're breathing out. The second most thing that it's important is body mechanics. So how can, when you're doing things around the house or sitting in a chair for long periods of time, how can you optimize the position? So again, your body's working for you rather than you sort of fighting your body, if you will. So when it comes to sitting position, I really recommend that people are sitting on their sit bones. We tend to kind of roll too far forward, and then we're kind of sitting on the flesh of our thighs versus rolling too far back and slouching, which is very common. And then you're sitting more on your tailbone, if you can feel that there.
Right.
So I really recommend that people kind of find their place where their pelvis, if you're thinking of your pelvis as a bowl of soup, thinking of it as kind of being upright towards your head. So again, your head is in line with your pelvis. Now the core, when we're thinking about the core, we're thinking of it as an apple core through the body. So all the way from the top down to the bottom of your tailbone, that all needs to be in alignment for your core to be functioning optimally. Right. And so when you're sitting in this sort of position, exactly the way you're sitting right now, it's kind of hard for you, if you keep your pelvis where you are, it's hard for you to get that slouch position. Can you sort of feel that there, Doug?
I can feel it. I'm actually feeling better just talking to you.
Right.
I'm like, well, my back's going, oh, okay, that's a way to look at it. So.
Yeah, definitely.
That's fantastic information. I'm actually already feeling better. My back is feeling stronger. So for our audience, I wanted to know, what are your recommendations for maintaining general body health moving forward in life, and just the basics of what you tell your clients, how to continue feeling healthy? So generally, in terms of body mechanics, just trying to take care of your back and your knees and those sort of vulnerable joints, especially if you're doing heavy lifting and that sort of thing in your field. Right. Just trying to protect that as much as possible. The other thing is just paying attention to what your fatigue levels are. When are you feeling like you're getting tired, and kind of optimizing your energy levels to what your intake of calories is, so you can kind of get to a point where your baseline is optimal and you're functioning right. You're functioning
at your most optimal at all times of the day, and when you need to be, and then you're resting fully when you're sleeping. Another thing that I see a lot is that people have a hard time because of stress and different things that are going on in their life with sleeping soundly. So teaching yourself how to sleep soundly, how to manage your stress. Also, can you reduce some of the impact through your joints so you're not having to go through surgery or go through rehab for extended periods of time, or really go through pain for extended periods of time? So, coming down to the basics, bending so that you're not squatting down on your knees, trying to kneel more on your knees so that you can protect some of your knee joints, trying to keep your head again in line with your tailbone at all times. Even when you're squatting or bending forward, you still want to keep your head more in alignment with your tailbone so that you're, more sticking your bum out backwards behind you, so that you can keep all that in line rather than crushing through those back joints.
Right. So some good tools basically for daily living.
Right.
fantastic amount of information, Rupal. And my back's already feeling better, and I want to come see you. But what I want to know is how you got to this position, how you got to know so much information and be so useful to all of your clients. Tell us a little bit about your background.
So actually, Doug, that's a good question. I started the business in June of 2010, so we're fairly new to Austin and been received very well. This is a great place to be. Everybody's very athletically oriented and sort of taken us in with open arms, so it's fantastic. A little bit about my background. I went to the University of Texas for my undergrad, so go Horns, and then I went to the University of Miami in Coral Gables to get my doctorate in physical therapy. From there, I moved to Europe for about 2.5 years where I studied Pilates, and that's really where I found my passion for physical therapy. It kind of all came together at that point, and the great thing about studying in Europe was that it is such a mainstream sort of technique used in Europe, and you know, learning from that sort of aspect, how it's kind of gone through the different phases, you know, in Europe, and kind of bringing that back has been great, because here it's kind of, you know, a niche sort of market that I've been able to get into, and people are looking for me, and vice versa, and sort of it's been a great place to be and apply these fantastic skills. Also, you know, my passion is Pilates. Physical therapy doesn't exist for me without the Pilates aspect of it. So I really believe that this is the platform for movement to really take place and to grow for somebody. And so it's a fantastic place for me. And the other thing is that, you know, I'm extremely passionate about not only teaching somebody how to move or fixing their dysfunction, but also teaching them the tools and giving them something so that they can take away and go home and say, you know, 6 months from now, if you're still experiencing this pain, then Rupal taught me XYZ. I can pull out that exercise sheet, kind of get that going again, and now all of a sudden I'm coming back to the things that I used to remember. So really it's more of a facilitated environment for somebody to grow throughout all aspects of their life rather than just fixing their problem.
Well, Rupal, I have to say, I feel better, I feel more knowledgeable, and I'm going to have to come see you.
Great.
So thank you so much for all of the information and for having us over today.
Well, thank you so much for coming out. I really have enjoyed this.
And thank you for joining us. I'm Doug Keating with Structural Environments, and until next time, we'll see you then.